Blue Cross Blue Shield. So, and that, I'm not criticizing Blue Cross Blue Shield, but it's a private insurance plan today. It's a business. And I just want to make sure that there is affordable options available to those 47 million that we're now telling have to have insurance. I want to make sure there's an affordable option for them to have available as they buy it. So that's one of the issues. We have provider issues under Medicare. You know, the federal government spends most of its money in health care in the Medicare system. That's where we spend most of our money. So we look at bringing down the cost of Medicare. Well, we could reduce the premiums that we pay for private insurance in Medicare. That would reduce the cost. We can look at what's known as a super med pack. I'm not going to bore you in all these details, but currently the rate structure in Medicare is established mainly by congressional action. That's rather cumbersome to change the rate structure, the reimbursement structure. So there's a thought, and President Obama would like to have administrative ability to do that. Well, that's controversial, but it's one of the issues we're looking at. We're looking at a basket approach where we will provide a different attitude towards primary care than more costly specialist care. So different things we're looking at, and we want to fill the donut hole in the Medicare prescription drug plan. Now, let me get to what is one of the most controversial issues, and that's cost. How do you pay for it? Now, you might say, why is there a cost? Senator, you've been telling me all the savings we're getting. Preventive care, health information technology, all the insured. Doesn't that bring down the cost? The answer, it does bring down the cost. But we're now talking about the taxpayer's cost. In order to do this, if we had everybody insured today, we would get less tax revenues in because we would have more benefits in your employment, which are tax preferred. So if everyone has insurance, there will be less income taxes paid because of the deductibility on your income tax. And if we get more people in the Medicaid system, which is one of the things we're trying to do because we want lower wage individuals to have some subsidies, that requires government to put money up. And if we're going to invest in preventive care and research, et cetera, that costs money. So it costs money in order to get to the plateaus that we want. And the Congressional Bean Counters, known as the Congressional Budget Office, will not score the savings. And look, I'm not criticizing that. I think we need to budget conservatively. That may seem strange coming from Washington to say that, but I really believe that. I really prefer us to err on the side of less debt than more debt. Less spending than more spending. So I'm happy that we have to pay for these investments. We don't get credit for saving someone from getting unnecessary care and getting their diseases detected earlier. That won't get scored. So we're going to have to figure out how we're going to pay for all this. Now, here's where the controversy comes in. There's a House committee that says, let's impose a surtax on those who make over $350,000 a year. Well, you make less than $350,000 a year, I guess you think that's pretty good. If you make more than $350,000 a year, you think that's a terrible idea. That's a controversial provision. President Obama said, why don't we just cut off at 28% breaks we give people on itemized deductions? That's another way we could try to pay for this. Then there are those who say, you know, why don't we tax that product that causes a lot of these problems? That's these sugar drinks. Why don't we just impose? But President Obama said we don't want to impose a new tax on middle-income people. And people who drink soda, last time I checked, a lot of middle-income people. So that's a problem. So then they said, well, why don't we just tax the benefits? Why don't we say that if you're getting one of these premium plans, why don't we take over a certain amount and then have you pay taxable income on the benefits so you don't get the benefit structure? Well, that plan has a lot of attention in Washington, but the problem, that's a slippery slope. And ultimately, you could see an erosion of employer-provided health benefits, which is what we're trying to build on. So it may be counterproductive to what we're trying to build on. Or maybe we should just take it out of the doctors and hospitals, you know, reduce the Medicare premiums more, benefits more. Well, you do that, you're liable to deny access to care. For every suggestion we have to raise money, there's problems on the other side. We've got to resolve it. And I come here tonight to tell you it is not resolved. It's an open issue. The Senate Finance Committee, the body that I serve in, has not made a judgment on this. So we appreciate your views on that. And there are many other issues that I could talk about. I just want to conclude this part by telling you the President has identified this as his top priority. The leadership in both the House and Senate are prepared to try to move this bill forward. In the Senate of the United States, that requires 60 votes. Now, we do have reconciliation instructions that in October we could use for simple majority. But we're working to try to get 60 votes. I personally believe we'll be better off if we can try to find a bipartisan way to resolve these issues. So I'm hoping that we're going to be able to get a bipartisan bill in the United States Senate. Now, you say, why do you need that? Don't you have 60 Democrats? The truth of the matter is, we don't have 60 Democrats who think the same way on any one issue. And that's fine. I don't have any problems with that. So we have our work cut out for us. I am optimistic that we're going to succeed. I think we've got to get something done. I agree with President Obama. The only option that's not acceptable is the status quo. We can't continue these ever-increasing share of our economy going to health care. I'll just give you one reason why. If America is going to be competitive internationally, we just can't burden products that we make with the type of health care cost that's associated with it. It's such a high percentage of our economy, and we're not, again, getting the health care results that would warrant that type of expenditure. I know we have the best health care in the world right down the street at our great centers at NIH and at Johns Hopkins and the great centers in Washington and University of Maryland Medical Center, best technology in the world. I understand that. I want to make sure we continue that. But when you look at infant mortality rates and you look at some of the disease issues, we don't rank very high. There's countries in the world that rank much higher than us. It's been a lot less than we do. So we want to get this right. I'm confident we can get it right. We need your input. We don't want you divided as for or against. We want you engaged. It's what is the right answer for health care reform in America. And that's why I was so excited to have this town hall meeting to hear from you. I must tell you, we have a great congressional delegation that I work with. Senator Mikulski sends her regards. She is testing out firsthand the healthcare system in our community. She'll give a full report to me tomorrow when I talk to her. For those of you who don't know, she had an injury and broke her ankle and is currently in Mercy Hospital in Baltimore. So she is expected to go under surgery for fixing the break. And your House members from Prince George's County, Steny Hoyer, Donna Edwards, and Chris Van Hollen are all right in the thick of things. Chris serves on the Ways and Means Committee. Steny, I need not tell you, is the majority leader of the House of Representatives in the middle of all the discussions, and Donna Edwards is one of the more active members of the House of Representatives. So our entire congressional delegation is trying to work together on this issue, and we really do look forward to your input as we try to get this right. And with that, I'll turn it back to Dr. Dukes, or should I turn it right over to Dr. Schell? Your health commissioner.
Well, good evening, everyone. Thank you, Dr. Dukes, for having me, and thank you, Senator, for allowing me to give some brief comments here this evening. The topic of health care, in my mind, brings forth two words, that we have to choose health. That whenever you're making a decision, whether it's a decision where you're going to spend your dollars, whether it's a decision about what you're going to eat, what you're going to do with your body, what kind of legislation, what kind of changes you're making in the environment, in buildings, and in roads, and sidewalks, and parks, that we have to choose the healthy alternative. When we're talking about choosing health, as the senator stated, that we can't continue to do the exact same thing that's been done all along. If we do the same old thing, we'll get what? The same results. And from a healthcare perspective, as a physician, as I look at and have practiced medicine in every possible arena, except in military duty. I've never served in the military, but I probably practice in every other type of environment, circumstance that you can possibly practice medicine. And people need a lot of help with their health care. Whether you have insurance, if you don't have insurance, if you're clear about what you want, if you're an educated consumer, if you're an uneducated consumer, this quagmire of health care causes problems for everyone. Prince George's County represents a very